Dr. Nikhil Bhatt. I'm working here as an intensivist here in Saifee Hospital Tanzania. I have a work experience of more than 10 years in the field of critical care. Let me introduce you to our intensive care unit. We have a 33 altogether. We have a 33 bedded critical care beds, which are divided into adult ICU, neonatal ICU, pediatric ICU. We're full-fledged with the state-of-the-art equipments, which includes everything like monitors, ventilators, beds. So as per our ICU, we have the state-of-the-art of ventilators, which can be used both as a non-invasive ventilation, which can be used as an invasive ventilation, and it can be also used as a high-flow nasal cannulas, as we used to use it in the COVID era and all. It has all the three functions in it. Now, regarding our monitor, it's a fully functional high-end monitor, which apart from recording the ECG of a patient, apart from recording the blood pressure of a patient, apart from recording the respiratory rate and even the SpO2 of the patient, we can even go up to, we can even use that. Our monitor even has arterial line tracing graphs. We can use a central venous pressure monitoring. We can use also even it goes to the end-tidal CO2 monitoring. On each bed, actually, we have 2 ports allocated for everything. For example, we have oxygen ports. There is always a 2 port in case of a backup. For a vacuum, we have 2 ports in case for the backup. And everything, and all the beds have clean power, so that even if there is discrepancy in the power, we have a constant backup. Apart from that, we have HEPA filters replaced on each and every bed. I think that's first of the kind here in Tanzania. And apart from those, we have also isolation wards, which have its own air handling unit. Like in the adult ICU, I can talk about that. We have 5 air handling units just in the adult ICU. I think that's also a first of the kind in the Tanzania. What do you mean by the air handling unit? It means that if a patient is in isolation, which actually the air of that isolated infected patient will not mix up with the other patients. So it drastically reduces the risk of nosocomial infections in the body. From the state of the art equipment, I will also say that we also have a point of care here in the ICU. For example, blood gas analysis. We don't need to go to the lab and do it. We can do it on board. We have a fully functional ultrasound machine which has all the probes. For example, the cardiac probe, linear probe, linear probe, all which can be done for echo, central lines, placements of the Dopplers. Everything can be done here in the ICU. That gives us a trend, and that gives us a trend of a patient for the last 12 hours, 24 hours, 48 hours, as much as we can give. That helps us a lot in understanding the hemodynamics of the patient. That helps us a lot in understanding how is the patient spent in the last 24, 48 hours, and how we can act on it. It can even give us a 12-lead ECG. It can give us both presentation of a patient, both in the numerical form as well as in the graphical form. We have an 8 functional ICU bed that can be used as per the requirement of the patient. And on each bed we have an alpha mattress or the air mattress, which reduces the chances of the bed sores in our ICU. We're here in the ICU go with a nursing system ratio of 1:1. For each patient we will have a 1 nurse. For the nurse to be there stationed at the patient side, we provide them tablets at each bedside, so that in order if she has to order something, if she has to get something, she doesn't have to move around around the ICU, so that she remains most of the times with the patient. And similarly, we have the tablets for the doctors too. We have the state-of-the-art infusion pumps too, which can even tell us into the details of how much dose it is going, at what rate it is going, which is very important for the critical patients. We have automated card. It's a keyless ICUs which we have. That means we have all the entries to the ICUs are through the card system, by the computerized system, which helps us in reducing first the cross infection, second unnecessary people or the people who are not required are not into the the access of those people are not into the ICU, so that we decrease the cost component. And most importantly, it's very important for the security of the patient, because the specific card is given to the specific relative of the patient, so that no one else can come in. Apart from that, we have all the equipments out here as already explained, and we have a fully functional crash cart which can deal with any kind of the emergency situation. All in all, we here can cater all kinds of patients, be it cardiac, be it neuro, be it gastro, be it any post-surgical patient, be it pediatric, be it neonatal. We are fully equipped to handle any kind of the emergency whatsoever. So I will say welcome to the Saifee Hospital Tanzania. Karibu, asante sana.